Thank you, Mega. Thank you. So thank you for all of you who are on Zoom and who are here, especially those of you who are here. This is supposed to be an interactive session. So I really want to hear the questions for all of you. We are going to try this different modality today. So I'm actually just here an accessory part of the thing. The stars of the show are Robert and Ravi. I get to know those guys going back to when I just started at Stanford. And when this whole innovation thing hits you in the head because you're working at Stanford, oh my God, it's everywhere. And so Ravi was kind of the first guy that starts making a little bit of sense to this. He was on biodesign. And I'm like, ha. And then Robert as well is another guy that is quite energetic and like it. And then we always go to some unstructured conversations that end up kind of how we ask. And that is some of the disclosures then, because you get intertwined into all this and then you make a lot of stupid investments that you shouldn't. And then next, and then you start, you know what, let's spread the word. So those are some of the seminars that we presented in. Of course, we went to Brazil, why not? And then we went to Hong Kong, Israel, we went to many different geographies, presenting workshops on biodesign. Robert in particular is very keen about developing curriculums that are linked to hackathons and workshops. So we always are discussing and teaching, but then now we are in that phase after 10, 12, 15 years going through this that we are becoming a bit more sober to this. So we decided, you know what are some of the lessons learned along the ways of being advisors, of being investors in companies, founders in companies that we would like to discuss with the team on the department. So with that said, thanks, Peter, to presenting your experience just 2 weeks before I come over here. And when I was a sabbatical, so I did not figure that out until I saw your lecture. And we are going to repeat a lot of the same things. Just thank you for doing that just now. Thanks. So, and just to finalize, it is the classic, let's start with the why. Why are we doing this? And I think very few things can summarize it all better than those two graphs. One is how much we are spending in healthcare, especially in this country. Our country spends around 20% of GDP in health as of this year, and it does not necessarily translate into better outcomes, better results. And I personally do have, especially here in this room, many people from other countries. And I feel a personal responsibility to this because I feel that a lot of people come here to learn things with us and how do we do healthcare. But then I keep seeing the way we do healthcare in academic medical centers in this country does not necessarily translate into how it should be done in other geographies. So I think it is important to discuss this topic even more. And that's why how to innovate in healthcare, not only through new technologies, but ways of delivering it is important. That said, let's go back to technology. This is a very important video, and I would pay close attention to this, please.
So, you will survive. It's just a garden variety panic attack. Welcome to Silicon Valley. We see people like you all the time.
Really?
Yes.
Let's just have to make this decision by tomorrow.
Yeah. You know, a while back, we had a guy here in almost the exact same situation. Take the money or keep the company.
What happened?
Well, a couple months later, he was brought into the ER with a self-inflicted gunshot wound because he really regretted not taking that money.
He shot himself because he turned down the money?
Yeah. Or no, he took the money. Or no. No, he did not. You know what? I don't remember. But whatever it was, he regretted it so much that he ended up shooting himself, and now he's blind.
Blind?
Yeah, just FYI, if you're ever going to shoot yourself, don't hold the gun up to your temple, okay? Because that just basically took out both of his optic nerves and then, half of his face. Then his wife left him because, yikes. And he may have been a genius programmer, but not so much with human anatomy. Or decision-making, for that matter. Now he's got to live with all that and whatever terrible decision he made about the money.
And what do I do if I feel another panic attack coming on?
Would you be interested in a device that links up to your smartphone and it keeps track of your vitals and it tells you, even before it's happening, whether you're having a panic attack or an actual heart attack?
Yeah, that sounds great.
You would, right? Okay. That's great news because it's still in prototype phase right now, but my startup partners and I are looking for a prototype today. So will you please let me know? I'm going to give you my number if you do end up taking that $10 million, because we could really make the world a better place. Oh, oh, jeez.
And and with that, Ravi.
Yeah, so that's a caricature of what happens here in Silicon Valley, but it also brings up interesting questions around how do physicians and industry collaborate together on bringing forth new innovations into the world. And so we're going to present a series of case studies here, really just to spark conversation and share some stories of our experiences, and hopefully it'll impart to you some of the mistakes we've made and lessons we learned along the way. So first case, you are approached by an early stage startup for advising, because many of you are expert clinicians, your opinion is always sought out by folks in the startup world. You have an initial coffee meeting, and you think the idea is interesting and has potential, but they need a lot of help. They ask to have a follow-up meeting, but haven't brought up compensation. So what is your approach?
Let's open to the audience. And what do you think? I'm going to start calling names here. If you guys don't say anything.
Maybe just start off with how many has this happened to so far? Okay, you.
So,
or what questions might you guys have about the approach, or how to approach it? Yeah.
I think if you're good at something, never give it away for free. But also it's very difficult to value your own time. So yeah, I'd probably ask this.
Yeah, if you get the milk for free, or what's the expression? Yeah, about the cow, the milk.
Yeah,
Totally. Yeah.
anybody else has any opinion there? So, do you go? How much time are you guys thinking? You know what? How many of you would schedule a follow-up meeting, perhaps?
A follow-up meeting has to move things forward more than the initial coffee meeting, right? I mean, you have to think that you're not going to keep going through the same thing, just giving more and more information, right? So I think depending on what was brought up at the initial coffee meeting, you could say, where do you see this going? And what kind of relationship are we going to have to make this work, right? And I think that's a very reasonable thing after a coffee meeting. I think all of us like a cup of coffee. All of us like to know what the interesting thoughts are that other people have, and all of us like to feel important because we have something to say. But I do think that after a meeting where you learn more about it, it's reasonable to start defining what the parameters are and how you're going to be involved.
That's exactly it. I'm gonna tell you what they offered me this week.
Yeah.
No, later.
Okay. Yeah, so I think that's exactly right. And oftentimes what we might see, so again, my background, I am an engineer originally by training. I've been involved with medical device companies and startups for the past 15 or so years. And it is definitely like there's usually like a freebie. Where you're just learning, and usually that might be like an initial coffee meeting, you're just trying to find out more about each other. It's different if it's a very established company reaching out, so that's probably a very different kind of conversation than an early stage startup, depending on what stage the startup is at as well. But I think once you have that initial coffee meeting, as Dr. Blevins mentioned, what is really your interest level at that point? Right, and sort of, are you interested in kind of working on this more, or do you have time to do it, and at what level? And in terms of the compensation, usually what I have seen is that the expectations can really depend again on the company stage and how much funding they really have. Funded companies, actually, if they have some kind of funding. The advice I've gotten from my own investors is to give an hourly compensation that's fair. Don't give any more equity. So one of the points of getting funding is that you have money to spend and you're not giving away equity anymore. So that is something to, something if you're thinking about equity as part of the conversation, that's something that from the startup side, they really try to retain equity as much as possible. So that's a conversation that we have. If they're early funding, if they're still early, or you think you have a really key insight, or there's a key role for you as an advisor, or maybe even like a board member, then equity is oftentimes is back on the table. And especially if they can't afford to pay you, then equity is the only thing that could potentially be of interest to you. And so you can look up online in terms of, or talk to other folks that have experience about what are typical equity ranges. Does that make sense?
And what type of stocks or what kind of equity are you thinking?
Yeah. So it also depends. So there's different types of equity. There's actual stock in the company, which is oftentimes given at the very earliest stages or to founders, for example. Or there are something called options, which is not actual stock yet, but it's the right to purchase stock, which is given to employees and consultants and other folks maybe a little bit later on in the chain. And so those are just something for you guys to be aware of that are treated differently.
And that is important because a lot of times when you are an advisor, and guys correctly, it is when you get the options, there are a lot of tax considerations that you do need to understand upfront. Everything that, especially because the options are given to you at a certain price, then when you sell, it's going to be at a much different price. So you sometimes, if you're given options, make sure you talk to the company with your lawyer to make sure you are having the right tax strategy over there.
Well, who has equity in this room in any startup? Anybody have equity? And how did you, could you explain it to other people who don't have it? What does it actually mean? The value, because I think we throw around the term all the time, but I think maybe a lot of people don't know what that means.
I think one of the things to take into consideration also is what sort of restrictions you have, because dilution is obviously like a huge thing that will completely change the value of the equity, and different types of shares may come with different types of dilution protections. And so if you're the only person who has, equity that's sort of going to be diluted in every sort of event that expands the pool of money into the company, then, very quickly your equity is not going to be worth that very much. It may start with a 1% that ends up being a 0.0001%.
Yeah, and especially that's a very good point, because advisors are usually giving common stocks or options, and then as they get down the line, they are not exactly, can get quite diluted.
And especially because a lot of investors who end up acquiring equity not for their work but for their money will put caps on the valuation for the company relative to the investment amount, which means that if there's an event that increases the value of the company for those specific shares of equity, it will be capped, and so they will retain much more value than everyone else.
And that's an important thing to be aware of, because if you are continuously being involved with the company and they go through a financing event, like you said, there's going to be dilution to all of the shareholders, existing shareholders that aren't purchasing more equity at that moment. So that's a point, if you're interested in continuing to do work and you want to retain some value, it's a point that you can potentially bring up. Say, hey, I know this financing happened. Some companies will give, re-up, they call it re-upping key members of the team, including sometimes advisors, in terms of the amount of equity that they might have. So they probably won't bring you back to 100% or more, but to try to mitigate some dilution that's happening. But that is really the key thing. It's not really, doesn't matter how many shares you have, it's really the percent ownership of the company and how that changes over time as the company gets more and more money. And as we know, healthcare companies need a lot of money to usually get anywhere meaningful in terms of getting to commercial or to patients. And so you end up, everyone in the earliest stages gets basically blasted to almost nothing. So it's an important question if you're interested in kind of maintaining that and having that be worthwhile, worth your time. Yeah.
I have Dr. Nayak on the Zoom who would like to add on to this. If you can unmute yourself, please.
Yeah, no, I love the topic. Hey, Ravi, good to see you again. I have a relationship with one of the startups that I did both. I think I have a 0.5% equity, and then I asked for retainer. So it's because I don't know if it's ever going to turn into anything. So there's something, the equity, if it leads to, something great down the road, that's in hand, I guess. But then just so that I didn't have to bill hours and document hours and do all that stuff, I asked them to, pay me, quarterly a certain amount. And then they can call me whenever they want, or they can email me whenever they want, and we're just gonna be in a small retainer. And then there's no stress and then also at least there's something coming to me for my time in case the company just completely bellies up. So anyway, just another thought to the conversation. That's all.
That's a very smart move, Jacob, that I would say. Does anyone in the room know what a retainer is? Yeah,
Sorry. I was just gonna say, if you're able to scoot your chairs in slightly or speak louder, they're just having trouble hearing you.
Oh, okay.
No problem. But thank you. So no, I don't.
Thank you, Mega. I thought Mega wanted to answer that one. Does anyone know what a retainer is? So Flavio knows what a retainer is. Does anyone else? I will call you again, Flavio. Flavio's like, hey, kid in the first line. Does anyone else know what a retainer is? So Flavio, do you mind explain to us what the retainer is?
Sure. So a retainer is a type of contract that guarantees that you're gonna receive a certain amount. It can be a certain number of hours at a certain rate, or it can be just some specified value for a certain time frame.
Yep.
And so, for example, as Dr. Nayak was saying, he probably has something more along the lines of just every 6 months, he will receive some level of funding. The contract may specify that that's for a certain number of hours,
yep,
but he doesn't need to track it. Or there are some situations where you do need to track it, but even if the company doesn't use that number of hours, you're still guaranteed on their contract to receive that. One of the things I think is also interesting about being a physician in this space is that there are regulations about physician pay for companies. Many smaller companies don't necessarily follow this because they probably are even unaware of it, but bigger companies do. And so there is legislation around fair compensation for physicians being involved with healthcare companies. And so bigger companies will actually have access to a database of physician pay and things like that, and will often come back to you and say that the rate that they determine is a fair rate,
yes,
along a certain range. And so they will use that to try to negotiate against you in some ways. There's always obviously some latitude, but it's a little bit more restricted than if you were not a physician and could basically just set your rate at whatever you wanted, and they would never be in trouble for that.
That is important, and feel free to jump in, but that is important, especially when you're doing consultations with more established companies. Let's say larger companies, then yeah, definitely they are going to go according to your level of seniority and curriculum. They're going to offer a range on that. But there is always room for negotiation on that one.
Yeah, I'd say from my experience, part of that rule is around if the company is commercial or if they're in clinical trials, they'll have different sets of rules around reporting, Sunshine Act, for example, and things like that, and overall limitations versus if they're a very early stage and there's less potentials for conflict of interest, which is another point that we'll talk about here in a second. I will just make another point about retainers that, I think that from the couple of examples that I have, it's a pretty exceptional place where retainers are used. Dr. Nayak is a very high level key opinion leader, and so, but it's not something that is thrown around. So it's something that depends on kind of what, again, the role is for that person in the company as an advisor and what their kind of ongoing commitments are to the company. So Yeah, so something that we kind of used very sparingly, but an important part of the options as well.
Yeah, I think the case was meant to be like a startup that has no money at all, and all they can give away is equity, to start off with. So you'll get a piece of paper, you'll have a contract, and they'll be like, here's 80,000 shares. So the idea is that if you didn't know what that means, what would you ask? How would you know its value? How do you know that you should jump in or not? So you got to know, well, how many outstanding shares there are? What is the price per share that is going to be set at before they have a priced round? Usually it's very cheap. Is that options, that you're going to buy them, so you actually don't really have them, and you need a way to track that? And then, is there a vesting period, because you have to be with them for a certain while. You're actually not granted them, all of them immediately, for example. How does that work? How long? So there's a lot of little intricacies that you have to kind of get into, that if you haven't experienced it before, sometimes it is better, of course, to try to do a little bit of both. Take $1 per hour value, split with some equity, and that generally happens with larger companies that are already earning revenue and they want you as part of their board. So maybe you're like, on a advisory board that maybe is meeting all the time, so they're paying for your time and expertise. And so that usually, there's a certain phase of career in medicine in general that maybe that you wouldn't be there necessarily at a lecturer level or something. So, assistant, associate, full, there's going to be different sort of value add and how much they'll compensate you and how much you can negotiate. But getting involved early, especially the larger companies, you can kind of see how it's more standardized, like the companies that report under Sunshine, like biopharma or med device, and then from there you can maybe get into helping these younger companies get to a revenue positive or a profitable stage. I mean, that's kind of what I'm trying to figure out when I have the coffee meeting. Are you guys, are you going to get to making revenue very soon or not? Or is that going to be like, 5 years on a regulatory path or longer? Is this something that I have a lot of time and going to help, go along? And therefore that's like a large equity stake beyond just, an advisor level, like the 1%, that's something like at advisor level where maybe an hour a month, few hours, talking, that kind of thing. So there's actually a lot of room for variability here that we kind of left it open so that people can kind of, discuss different options. Because actually I've experienced all of these different kinds of scenarios, just very small amounts, asking for larger amounts on equity, asking just for, the dollar per hour, splitting it. And it's different with different companies and how much you know them and all this kind of stuff.
So how does Stanford treat it in terms of the conflict of interest? And when do you have to, how do you guys disclose it and things like that?
Yeah, so oftentimes you're doing something that's related to your own specialty. So I'm in ophthalmology, so a lot of eye-related things are coming to me. So there's the few considerations that you might want to think about is what is the total value amount? Because that's something that you need to report on the Stanford's, conflict of interest. And at certain thresholds, it becomes a level where you can't do certain things. Like, let's say you want to run studies for the company, but you also want to be an advisor for the company and be paid. So typically you can't do both things because it's going to cause a bias or undue influence, and the ethics, COI, there's a whole department checking on this all the time. They'll think, well, maybe at a very low threshold, not hitting like less than 5,000, could be annually, could be not a bigger deal. But then you start getting the higher thresholds, then you can only pick one because you'd be conflicted. So a lot of times you like think about it, is this my research goal, something I would promote in research and get clout through that angle, or is it really someone else is doing that and I want to get more consulting hours and more hourly compensation because the company has money to pay for that? So you can start thinking about it like that. And then what kind of resources you're using, because sometimes the startup is coming out of Stanford, so already that means the intellectual property and the ideas, and you might already have ideas in the same space that you're trying to keep separate and not use Stanford resources. It starts to get tricky there about what is your own time, what are you documenting as tied to Stanford, you help the students helping you tied to Stanford. Your own lab funding, okay, that's tied to Stanford. They're pretty clear-cut things that make it so that then you have to take that into account. And so if you're bringing in an outside entity, then it becomes tricky there. So there's a lot of offices that you can contact, so you make sure that you're free and clear and not having conflicts in that way. But at the beginning, oftentimes it's just like talking ideas, and there's not really something outputted at that point. Because in medicine, generally, unless it's something totally non-invasive, there's very specific pathways, and that's why we all learn biodesign, to understand how to mitigate risk when you're running these heavily regulated new ideas.
The other point I think it is, that's awesome. I think any of you ever, if you feel that OPAX thing for any conflict, actually you will learn a lot just by feeling that. You don't want to do, but in a very practical perspective on the conflict of interest, I don't know, especially when you do those early stage companies, they just got their fund they get their Series A, Series B, they want a commercial traction. And quite frequently they ask, hey, can you help us to get early traction, early utilization at Stanford? And I really try, or not that I tried, don't really want anything to do with that. So that is one I would highly recommend you just don't. If you're doing research with someone, just say plain no. I'm not gonna, this is not with me, I'm not gonna have you do anything with commercial introduction at Stanford. And you will be surprised how many times it actually, the company wants that to you. The other one that I try quite hard not to, it is do something that is closely related to my research. And that is tricky because a lot of times they want, because they have the expertise, but I try not on the research field, not on the research domain. I try not to get too close to work with companies as an advisor or as an investor, which is something I do research with.
Why?
There is always the environment is very small, and the company always wants some access to something that you are working in. There are so many moments that it gets uncomfortable. Also, there are many IP conflict, and there is the IP conflict. Correct. Yes. Yeah. Into that. So I try not to go on that route as well when I do development. But this is all very important. Again, just emphasizing, I think this transparent interface with industry is needed to move things along. I think that is one of the reasons why companies a lot of times do not have high quality data, high quality research involved with them. So we have a lot to offer, but it gotta be transparent to this.
What is Stanford's rules about if you're compensated by the company? Can you be a PI for a clinical study using the technology, or can you be involved with clinical research?
If I'm an advisor to the company, I receive compensation as a consultant or advisor. Yeah, no. Yeah, Stanford does not allow it.
So what's your decision making about whether or not you should be involved with the clinical research versus becoming an advisor? You guys weigh those decisions?
That is specifically never happened in my case. To be honest, if it is, let's say, an industry-sponsored study that people are trying to run, when I am what I have involved in the company, I kind of just let it up front. I cannot do anything with research with you. And the other way around, working with research cannot do an advisor role.
If another question, if the product is commercial, if the company has products that are commercially available already and it's used at Stanford, and you're compensated as a consultant or an advisor, can you use those products just in your normal patient care? And how do you handle the disclosure of that, or do you?
So the company wants to do research
No,
with a device that's already commercial.
So say they're not researching, just they have products available.
Yep.
It's already been FDA approved.
Yep.
Or cleared, but you're a consultant for them for some, you're a consultant or advisor to the company, and you want to use the products in your regular patient care, not clinical research. And can you, and how do you manage that?
Yeah, if you're an advisor to a company and you use products that they sell, that's covered under OPAX.
Yeah, I think it is this
section of clinical research and teaching, because they basically want to see what kind of undue influence will be to trainees, to your patients based on your choosing. And so there's dollar amounts, how much you're involved, what are you doing? It actually asks for details. Are you doing a data safety monitoring board for a study instead of a trial, or is it, are you a speaker bureau and you're promoting or marketing a product? You know, that would be a big conflict. Stanford doesn't allow you to do promotional things. Consulting means like strategy or you know, figuring out new R&D directions. It's not like trying to sell more widgets or trying to get Stanford to adopt this over something else. So that's pretty clear. You'd have to make sure that what is it you're advising on, and if someone from the office, OPAC's office, was looking at what you're doing, could you easily defend and say that, you know, I'm doing something during my consulting hours per quarter that is allowed by Stanford's rules because it's all in the faculty handbook, then you know you'll be okay because it's not creating a bias in the same direction.
So for a company that I'm consulting with now, CV as another example, it's an early stage technology company that's also running a post-marketing registry, and there's always questions around there, and some of the investigators in the study are investors, but they're not at an institution like Stanford.
Okay.
And so the company is like, well, how do we manage this conflict? And the way that the company decided to do it was to limit the number of cases that that person could do. Because say, for example, you submit to FDA 200, a 200 patient study, you don't want that person to be like 25% of the study, and now those potential results are potentially biased. So, you know, they wanted to use the study. They were an important partner. Their feedback was really valuable, but they also happen to be an investor. So, how do you kind of manage that risk? You know, so that was a private practice position. So there weren't any specific rules from their institution, but it is something that companies handle different ways. You know, in terms of how do you manage that, and how do you disclose to FDA, and you have to be totally transparent about it. And will FDA accept the data, or they question it? That becomes a question.
That's where you use the Wall Street Journal test. So if the private practice is accepting money and implanting all these devices, if you put that in the Wall Street Journal prime time, would people say object to that? That it was a problem because too many was done, and you know that basically, you know, didn't use medical decision making to choose that. If it's just one, and you know they just were experimenting, then maybe that's fine because all the data from the study wasn't tainted. So yeah, you have to think about it in that terms.
Hey, Robson.
Yes.
Just full disclosure is I was actually one of the major authors of our industry interactions policy in the past, and it's complicated, but it emphasizes a couple of points. One is it's about managing association, not necessarily conflicts. I don't like the term COI. It's really has a negative connotation. It's about healthful managing of how our associations. One of them that hasn't been mentioned is if you have a relationship, any kind of a financial relationship with a medical device company or with a pharmaceutical company, and you use that product with a patient in your practice, it's very prudent to disclose that. Because if there's ever an adverse event, there's a liability to you in the institution if you don't. A second recusal that's very important is you can have no role in purchase decisions on the part of the medical center. So if you sit on a committee or you sit on a task force evaluating something, you have to disclose and then recuse yourself from that decision.
Thank you, Rob. No, that is quite useful. That is quite useful. Thank you. How do you handle NDAs? Do you always sign an NDA when people ask you to do?
So from the company's perspective, you know, they're trying to protect any kind of information that might be they're working on that could be confidential. I remember working at my first job at a larger medical device company. I remember actually that my boss, who was an R&D manager, told me never brainstorm with a physician. Actually, he was very clear about that. Because of especially if it's not an established relationship where there's like a consulting agreement or something, and where the IP is clearly defined about assignment of the intellectual property. So if you're site visit or you're just talking with the doctor, do not do any brainstorming, do not and be clear with them, do not invent with me right now, don't give me any ideas. Because, you could be working on the same thing in your company, and now suddenly the doctor discloses it, now who knows who owns what? So, create a firewall. Oftentimes they will, like, we had doctors, it was a large cardiovascular company, so they would have doctors come with ideas sometimes, but they would firewall it from the research and development team so that there was no potential contamination of intellectual property. So they're trying to protect their intellectual property, and so if they want to talk to you about something they're working on, they want to make sure that it's beyond disclosing it, that also it's very clear that it was disclosed under some kind of a relationship.
Yep.
And so the non-disclosure agreement is sort of the first step of that. And there's usually provisions around the disclosure of intellectual property and things like that. So just be conscientious that if you sign a non-disclosure agreement, you are now kind of exposing yourself to their intellectual property that's being disclosed to you. And do you want that to happen? So again, kind of goes to your point about not really working in areas where you're researching in, because maybe you are researching an area that they're going to talk to you about, and now there's going to be some overlap, and it's going to be kind of messy to figure out which is yeah.
There are mutual NDAs though, right, that protect both parties.
There are mutual NDAs, yes, and that can be it can also be confounded. So in a mutual NDA situation, it doesn't solve the who invented what first or who contributed what. And so usually in a company situation, you try not to share real intellectual property until you get to a consulting agreement. And then in the consulting agreement, it talks about assignment of intellectual property ideally to the company if we're paying for the time in some shape or form. Now, Stanford has its own intellectual property rules, especially if you're using Stanford resources, and then that's where it gets a little bit, I think, challenging if it's something that's an area that you're researching in or that's your expertise at Stanford. And so something that you have to kind of navigate in terms of where is the line drawn between your expertise in research, and these guys can share their thoughts on that. Because from the company standpoint, it's very clear that companies are trying to protect their intellectual property.
So can I comment on it from the university point of view, Robson?
Please.
I urge our faculty and trainees not to sign NDAs before they're reviewed. Simple reason, there's a huge amount of research going on in the university that might overlap with the IP that this company has. So you want to have that reviewed, and you realize you have a personal liability potentially. The university may not stand behind you if the company says you disclose the IP, when suddenly some lab at Stanford you know nothing about ends up with overlapping or competitive IP. So it's a good idea to always don't think you're committing Stanford University to this and yourself personally. Just have it reviewed, give it to Jason. There's a whole system for reviewing NDA to make sure there's no problem with the university's interest.
And the other thing that I think helps, thanks Rob, that's very good. Stanford has a consultation rules and agreements. I would say, please always make sure you send that to the company you're about to consult with and ask them to review and see if they have anything. Most decent companies do a good work reviewing the consultation agreements. But when you do, and emphasizing a lot of the points that Rob just mentioned there, and again, just going back, that's why I personally prefer not to do any consulting work with companies that do anything close to what I do research. It is just odd, it's awkward talking to them most of the time. It's a very cool conversation when you're talking to people that deal with research you are working on and the unique insights that all of us have.
I try not to sign any NDAs, kind of like a VC.
Yeah.
They don't sign any NDAs.
Yeah, they're decent.
You want to hear from a lot of different companies. If you sign an NDA, that basically is preventing you from talking to a lot of other similar companies, because now you're going to have difficulty having those discussions. So it depends on how much interest you have in the innovation space. Are you wanting to know everything that's happening with a lot of different companies? Best to just tell me only what you feel like you can tell me, or I don't work with you, basically.
And companies, people that work companies should not get offended by that. They should be able to talk to you about the idea in a way that has public information only. And they don't disclose secret sauce or what have you. So it's very understandable, especially anecdotally. I think it's showing a certain sophistication if you're kind of not just jumping into it. So I think it makes a lot of sense. And then, yeah, when do you need a lawyer to review the contract? I think Dr. Jackler made a very good point. Probably, since you're representing Stanford pretty much all the time, if you can. And then, what do companies look for when working with physicians? I'll just make one small point about this, that oftentimes companies will sort of put physicians into stereotypical boxes. They're sort of like the early innovator type physicians that can see outside the box and understands, that something that can't exist yet and what might be, and that's certain box. Then there's physicians that are more about like, hey, how do we design clinical studies and evaluate it, this technology? And then there's the ones that are more like, hey, who are the key opinion leaders who have influence in the space, who know the big, especially for startups where you're trying to influence big companies. So, who are some of the physicians who also advise big companies, and it helps kind of establish relationships that then you can then get information into big companies in a more direct way through trusted clinical advisors to the large companies. Now, folks can be kind of all three buckets. It's pretty rare though, I'd say, but it's something that how a typical kind of medical technology startup would kind of view what they're looking for when they're working with physicians in all three of those areas.
But I think this is actually quite important. You're saying, kind of trying to understand most of the time, and I assume, at least I do, what are the companies actually looking at you? This is a very good point. It's kind of mind open when you get to that. Should we go for the next one? Yeah. We may not get time to go, but let's go this to all of them. But this is better, actually.
All right, we have a
Ross,
case,
this is yours.
case two. You identify an important unmet clinical need and work with two engineers to invent a solution. Over 6 months, on nights and weekends, you advise them and they develop a working prototype that you test and see really encouraging results. The three of you discuss the possibility of creating a startup. Doesn't that sound like Stanford? To raise funding and take this idea forward. The two engineers are planning to quit their day jobs and focus on this full time, while you plan to keep your Stanford faculty position, but still want to be involved in the startup. They want to set up a meeting to discuss the plan moving forward and how equity will be split, like actually forming a company. So has anyone encountered this kind of scenario before? You will. Hang around here long enough. You know people, you'll want to do a company together. Yeah. Well, as a faculty, you have a really good position here at Stanford, right? You generally take care of your patients, enjoy that. You teach a lot of people, that's very enjoyable. You maybe do research if you like that angle, and it's just, they're very resource-rich institutions. So a lot of Stanford people just want it all, right? They want to, enjoy their clinical day job and try to dabble in startup on the side, sort of like, you've got your guaranteed taking care of your life expenses, but then also have the excitement of, trying to build a unicorn or something. So I think that's a very common scenario. And typically, it's difficult to try to do everything. Like, how could you be a professor position, but also be part of a company? And Stanford has some rules, about a company. For example, they say that you cannot have a C-suite title. It'd be sort of conflicting with your roles and obligations to the university if you are full-time. So full-time, there's some people who are part-time at Stanford, and then that way, then the rules are slightly different. Maybe you can take a title of something else if you're kind of piecing together your salary, benefits, etc. But I think what's most important is to really decide what is it that you're working on. Are you working on something that's going to be the next Nobel Prize, or maybe that Nobel Prize can also be a company, or is it really just a product of another company? Can it really have a business model that's going to stand on its own, or is it just going to do something great for the world? Help patients, and maybe it's more like a nonprofit or a great idea that will never be commercialized. So putting it into these really large buckets sort of helps you define, like, is this in my strategic focus? Is this what I want to do? Is this my stage of life that I want to throw myself in and quit everything, drop everything? Or is it, I want to just advise and consult, kind of like in the first scenario case. So you have to kind of think about that and talk to a lot of other people, who've done it before, whether it's, helping on the side, X number of hours a week, or, just taking a sabbatical maybe, and trying out something different, and then still saving on that faculty job when you come back from your sabbatical, for example. There's a lot of different ways to do it. In terms of getting to what percent of the company should you own, right? How many founders are there? Should it be like, let's say there's 3 or 4 people, everyone split it equally? Or should be the person who does more work, more time, should they get more? Or the person who put in more money, maybe, because maybe not everyone has the equal amount of money put in. Should they have more shares or more ownership?
Or the person whose idea it was initially, should they have some special right?
Generally, a person who thinks that they ownership of the entire idea together values their share to be the largest, right? Like you were the inventor of the idea, but of course, as we know, ideas need to be executed upon in order to get to, generating revenue. So that's like a big gap. There's a long pathway, but for someone who never did it before, you can't really know what is involved from taking the idea to the market, especially in healthcare. And so at the beginning, you may think, well, it's all my idea, I should have most of the ownership. So there's a lot to discuss there, but we don't have a lot of time.
I think, and just kind of long story short on that, but I always like the YC formula and how to calculate equity amongst founders. Like they obviously like the worst thing you can do is actually divide the shares of a company in the beginning. You weigh the idea, the time commitment, the execution, the finance. There is some weight that you can allocate for each of them, and making sure that the equity vests over time. Yeah. So it may be that a person gets very enthusiastic about something, but then life gets in the way. The person is going to commit 6 months to the company, but then he's not going to commit moving forward. So making sure that this vests over time, so people who are committed, especially again in healthcare, that things are not going to happen over time. This is something quite important.
There's a general principle, I don't know if I will go to, but there's a general principle that like no matter where you are in the life of a startup or the life of an idea, or especially in healthcare, that 90% of the work is still ahead of you to get there. And so especially early on, I think that's true, that it's easy to really overvalue the just coming up with an idea. I mean, ideas are obviously very important and being creative is very valuable, but it's oftentimes, and whether or not this is fair, in the market, typically contributions that come later to get to the final finish line are valued higher in general. So even like investors, like when investors come in at later stages, they end up taking bigger pieces, at a higher price because they have to put in more money, but they end up taking bigger pieces of the company. And just like, actually at a startup I was at, the initial inventors who ended up not staying involved with the company, but kind of being on the board, ended up being smaller shareholders than the management team when the company eventually exited. Because if you think about the time spent on the company every day, what the equity is used for, it's really to incentivize people to be working on this idea in a continuous fashion. The market economics, that's kind of how the market pays out for equity and for time spent. And so like, for example, my company was part of this incubator called Y Combinator, and they would advise academic startups that were coming in. If they had a really large shareholder that was an academician, that was maybe a really key inventor, or someone that maybe they had more than 30, 40% of the company, they would advise recapping the company so that that person held less than 10% if they were not going to be working full time with the company. Because I think that's kind of market conditions for advisors, and that's still a large amount for an advisor, but that it sort of, again, sort of what is equity used for? Is to incentivize the founders to really pour their heart into it. And so for full-time people, usually what they try to do is they try to give them the lion's share of the equity moving forward, because they're really kind of sacrificing all their other opportunity costs. Like Robert mentioned, like it's, staying at Stanford is really, there's a reason why it's, you decide to stay at Stanford if you do. Like, there's a lot of value here, and there's a lot of other things, and you can do lots of different things. And so sacrificing that and jumping in full time into something is very risky. And so it's basically reward for that risk that you're taking. Yeah, Clark.
So I'm glad that you actually brought up your own experience, because I'll mention it from the other side of the same experience. First off, I think one important thing to always keep in mind is that these splits are going to be viewed by other people, right? So it's not something that you just decide and it's among, you know, the people who are founding the company. In many situations, they'll surface. For example, as you mentioned, for Y Combinator, I'm actually an advisor to another incubator, Skydeck, and I'm part of their selection committee. And similar things happen all the time. In fact, very recently, a similar situation came up where it's a red flag because one of the founders was not planning on committing full-time to the company, had more than 50% of the company, and the people who would be working on the company had much less. And so for an incubator, for an investor, it's a red flag because they want the people who are going to be putting in the work to be really invested into the company. And, you know, in this case, the full-time people had like 10%, investors had something like 30%, you know, and the person who came up with the idea and put an initial investment had, you know, over 60% or something like that. And so, and this happens all the time where, like, you know, this is flagged as a no-no and the company doesn't get an opportunity because of, you know, something like this. So it's important to keep in mind that it's going to be seen and it has an impact on opportunities that may arise.
That's excellent, Father. Thank you. Thank you. The other talk is here. That's awesome. This is much better than going to the slides, so don't worry about it. So
I was saying 5 minutes we have left. Are there any other questions or people topics you want to
that's
ask
you
about?
wanna
Yeah.
anyone up there?
Or just for discussion for the whole group?
I don't have any questions on the Zoom yet, but if anybody does have any questions, you can raise your
Yeah.
hand and I can call on you, or you can paste them into the chat.
Yeah.
But yeah, if anybody here has any questions to
So-
continue, you can.
I think a lot of you already know if you have an idea that you want to get started here at Stanford. We are very much partial to biodesign over this time. We think it provides a good structure in how to think about and move your idea forward, provide you a very extensive network of advisors here and connections inside the university and even outside. If you decide to take your project moving forward, there are connections, let's say, with forward and others that are close relationship with biodesign. Definitely, this Spark does the same, especially with the diagnostics and pharma, more or less in the same, somewhat similar structure. OTL, it's a whole lecture on its own, to be honest, but I would say that if you are using university resources to develop your technology, I would say that having a consultation early on with them would be quite important, and they are very helpful. To be honest, they usually reach a decision if you decide to, if you're brave enough to actually have a company, they will help you somewhat with that. If you are a normal person, they may want to help you license the technology to someone who must or who then they already have the whole strategy to go with you. Not sure if you want to talk about that a little bit, the OTL experience.
OTL, yeah, they do this all the time. And so the technology that I worked on spun out of Stanford. And so it's a negotiation just like anything else, but it's interesting when you're an inventor at Stanford and you're also the founder of the company licensing, you're kind of on both sides of the table to some degree. And that's a little bit odd of a situation to be in. But in general, OTL has pretty templated terms that you can negotiate the ranges a little bit and where money is spent up front or at the end, but they're pretty standard. The one thing that's great about OTL is that if you license technology at Stanford at the earliest stages, OTL actually usually they put in what's something called a purchase right. I think they still do this, and that means they have a right to invest in the company, or Stanford has a right to invest in your company up to a certain percent. Sometimes it's like up to 10%. And so that can be really valuable part of your fundraising plan that Stanford will, if you have other credible investors, Stanford will also participate. And then that's also really nice to have them on the cap table, and they'll reinvest. So it's a nice bonus as well. So OTL can be really great. And then, the licensing process isn't as scary as it.
So the next slide is just going to be.
I have
sorry.
I have Dr. Nayak here who has a quick question for you all.
Hey everyone. I think this is something that, of course, I think we should turn into a weekend a few hours. We all have so many things we could, share and kind of probably wouldn't want to ask, in this kind of 1 hour setting. But but thanks a lot for putting this together. And then the second thing was like the value of IP, in the sense of, let's say, everyone says, make sure if you have an idea, put it down on paper and date it and have it signed by somebody else in case a competitor comes out. I'm just curious about the reality of that, in the sense of, when is it just literally, you can literally have something brainstorm in your head, all right, this is going to be great for sinus. I don't have any resources or time to do that right now, but should I just put it on paper and then have someone else sign it, and literally then it might sit for a few years? Or do you really need to have like some kind of prototype, some kind of working model, some kind of drawing? I mean, when does it turn into something that's actually, protectable IP? Just a general question.
Yeah, I can take that. So maybe about 10 years ago, the US moved from what's called first to invent to a first to file, which was harmonized with the rest of the world. So it used to be that in the US, just like you said, Dr. Mack, if you write down an idea on a piece of paper and you have it in a notebook and it's been witnessed and you put it away on a shelf, but then 10 years later, someone else gets a patent for that, you can say, oh, actually, I invented that first. And there's some debate about that. Like, well, you have to have been trying to patent it. Like, if you just took, like, it's been 10 years, you probably wouldn't get any rights to it. But if it was like 1 year or 2 years, you might have been able to kind of justify and say, oh, I invented that first, and I was going to file a patent on it, I just never got around to it in this 1 year period. And because you have to show some effort that you're trying to protect it. But about 10 years ago, they moved to a first to file system. So now that notebook is pretty much worthless to some degree. Not, in terms of the patent law, you have to file something for it to have any standing in court. And so that's why the provisional patents are very useful in this scenario. So provisional patent is like, it's very cheap. It's like $150, I think, to file as a small entity. And it doesn't have to be like, a lot of law firms will recommend very comprehensive provisional patents that look like a real patent. But by the law, it doesn't have to be. It just has to describe the invention enough so that someone else can understand what it is. And it could be a PowerPoint presentation. It could be just a drawing and some ideas. And that is at least a line in the sand when you file it with the US Patent Office. So that really, Dr. Nagel, is the moment when it's now protected to some degree.
Interesting. Okay, thank you.
Yep.
So I think this is all good, because that is fun. We keep going. I think this is something that this is an exercise on biodesign. When you have a lot of ideas and you're thinking about, should I move this forward? Is this a unicorn? Is this a research project? Is this a nonprofit? Is this something I want to, depending on your values and your moment and what you want to do. But doing this kind of exercise that is done on biodesign with Ross, it is important, especially again when you have many projects that you are thinking about which one to select. Doing this exercise and putting some weight into market size of your market, the incidence of disease, patient impact, again, all those details is useful. Next. We have that as well, kind of just touching into this. You cannot be in a management position if you're at Stanford. You're not going to have time. You're just going to go for the last one. But then this is going to be mostly kind of, this is a question that comes all the time. You can be a founder. The title of founder doesn't mean much in legal terms. Your founder is someone that started a company, but you cannot be in a management position if you're a faculty at Stanford. You cannot be a CEO, director, vice president, etc. Those are things that should be avoided. You can have 90% of the stocks of a company. You cannot be a CEO. That's the way it is. It works. And then you should, the title, the things that we usually are here at Stanford are advisors or consultants. You can be a chief scientific advisor to the company. That's a term that sometimes people use. You see a lot of gymnastics in terms on LinkedIn that people use sometimes at Stanford as this. Next, we are not going to have time for that. Next one, Rob. Those are going to be kind of the thoughts. We touched into some of this, but we want to make sure that you think about the last slide only. But yeah, this is kind of the things I think that are important for you to think. Which time of, which stage of your life you are, exactly things that Ravi touched on. It is not a trivial effort to move one of those forward. You have obligations with Stanford. This is what your patients count on you, your colleagues count on you, and maybe your family counts on you on this. So you're going to need to pick and choose. You don't need to be in, as I told one on to Peter, you don't need to be the CEO of a company or having a high impact. Being an advisor to a company may be something that fits you better at this point. And it is important because sometimes people look at, oh yeah, you are a CEO? You're not a real entrepreneur. You are just part-time. No, you can have a significant impact by being an advisor in the company. Do you guys have any other points you want to emphasize to the team?
No, that's good.
Yeah. Rob?
It's 7 o'clock.
I know. Thank you for all of you. Thank you now. We are here for any other questions. I think we need to finish the Zoom, right?
Yeah, I don't have any additional questions on the Zoom, but if anybody here has any questions, feel free to ask. We are here for a little longer. But I would just like to thank you guys and give you a warm round of applause.
Thank you.